YouTube family? It's Shay. Welcome back to the channel where we talk about beauty, nursing, and lifestyle weekly, and I'm coming through this week with another nursing video. So this has been a much requested video for you guys, and I'm not going to keep you here long, but a lot of you guys would like to know what is the big motivator behind my decision to choose a family nurse practitioner route over an acute care nurse practitioner route. So I'm going to share with you guys just a few details on how and why I made my decision. The purpose of this video, I have to disclaim, is not to say that one is better than the other. It's not to say that a choice is better than another choice, and it's not to say that my reasons are like your reasons. I think my purpose in sharing this with you guys is for you to understand what, one, my reason is going back to school to be a provider, and two, I think hearing someone else's process of elimination or process of acclimation will assist you in choosing this. Some of you guys may watch this and say, yup, that's the very reason I also want to do family nurse practitioner. And some of you might watch this and say, hey, her reasons are the exact reasons I want to go and be an acute care nurse practitioner. So either way this flows, my purpose is to make sure that I help you guys make your journey easier by just sharing my journey with you also. So if you're interested, I know this is a long intro, but I had to explain that. Make sure you subscribe, make sure you comment down below, and let's go ahead and get started. Alright guys, so commonly what I hear from a lot of people, for me personally, with a background of almost 5 years in bedside, is you already know the protocols, you already know the policies, you already know how to treat these patients. So why do you want to go out to an environment that you're not used to an environment that you've never worked in, and take care of patients outpatient? And my first big reasoning is the development of a rapport with my patients. Many of you guys know, and I don't know if I've shared this in depth on my channel, my biggest purpose in going back to be a provider is I really dealt with the mental struggle as a bedside nurse, to the point that I had some nights where I came home crying on the fact that I could not even develop relationships with my patients because I was so task driven and so busy that I had no time to even just sit down with these people. And basically, besides knowing your name and date of birth, I couldn't tell you nothing about half my patients. And that really broke my heart, because my purpose in nursing was to not only be able to take care of people with the skills and the knowledge that I know, but being able to establish a rapport is important, guys, for patient care. Patients that are non-compliant, patients who don't take their meds, patients who don't, follow up on test results and things, one of the biggest ways to hold them accountable is to know that they have a rapport with their provider. And you'll hear a lot of patients say that, oh, I gotta go get my labs done because doctor so-and-so or nurse practitioner so-and-so is going to get me if I don't. And while that's not a big reason to, go, they should be doing it for themselves. Establishing that rapport really helps patients take the driver's seat in their care. So I'm not saying that inpatient, you're not able to develop a rapport, but it's a little bit harder because you guys see so many patients as an acute care nurse practitioner. Your job is to basically get these patients stable and get them on their journey to be able to follow up with care outpatient. And there's nothing wrong with that, but as a outpatient provider, you're going to see these patients constantly. They're going to come back in. You're going to be able to check in. How are you doing with this? How are you doing with that? Hold them accountable for their care, and really be able to kind of hop in that car of healthcare with your patients and take that drive with them. So it's not to say that you're not able to do it, but I knew in my heart that that's one reason I struggled as a bedside nurse, because I was so personable that sometimes the personability would take priority over the patient care I was supposed to be doing. So I'm not saying as a primary care it changes, because you still have to prioritize that safe patient care, but I just feel like I will be able to develop these relationships and just that rapport with my patient in a deeper context where I'll be able to help them on their journey in healthcare. I know some of y'all gonna hear that, y'all be like, shit, that was so freaking corny. But no, I had to speak from the heart, and that's one of my top reasons where I said, yeah, I need to be outpatient. I need to be able to, just do these wellness visits, do what I can do to prevent my second reason, which is preventing people from coming to the hospital. As a bedside nurse, guys, I have seen some of the same patients come through my doors, come through my beds over and over again. And some of the top diagnoses, y'all already know if you work bedside, especially if you work med-surg or if you work tele, you know what our top diagnoses are. We have our congestive heart failures where we need to diurese them, you know, get some IV Bumex, some IV Lasix, fluid overload, do a fluid restriction, and get them on their way. And we also have like our diabetics coming in with DKA, coming with hypoglycemia, etc., things like that, where we need to get those things in order and then have them follow up outpatient on their way. Now, here's my biggest issue with the things that go on. So I have, let's make an example. I have 72-year-old grandpa coming to the hospital, congestive heart failure, like I said. We're pushing Lasix or Bumex, whatever the choice is, depending on the kidney function and etc. We're putting him on a fluid restriction. We're doing all those things in the hospital that we're supposed to be doing, and these are good patient care, and these are quality measures, and these are things that should be done. But here's my issue. 72-year-old grandpa either falls while he's in the hospital, develops a pressure ulcer, or somebody put a Foley in and he got an infection. These are big things that people come in with problem 1 and leave in with problem 2, 3, 4, 5, and 6. This doesn't happen all the time, and that's why we have educators and quality measures and things like that in the hospital to prevent these things from happening. But it doesn't mean it doesn't happen. And I feel like as a provider outpatient, it is your job to, if you can, make sure you prevent your patient from having to even touch foot in that hospital. So if I got to bring you in, weigh you, see that you gained 5 pounds, and say, hey, I'm gonna give you, you know, a double dose of this, or I'm gonna, if it's one of those clinics where I can put an IV and give you a dose of IV Lasix and monitor you for 24 hours and then have you come back, and if it's bad, you go to the hospital. Those are things I kind of see. The best way to prevent hospital-acquired injuries and hospital-acquired infections are to not even touch foot in the hospital at all. Now, don't get me wrong. I know we need patient load and etc. to keep hospitals running, but sick people keep hospitals running. But if you can prevent some of these sick people from even having to go there, that saves resources, money, time, everything, and better quality life for the patient and for their overall health. Alright guys, and the last thing I'm going to talk on a little bit is just the pace and the responsibility of an inpatient or acute care provider. This is where I get into a little bit, I guess, of my imposter syndrome, but it's also just in general knowing what I see firsthand as a bedside nurse when I'm looking at my providers and my nurse practitioners in-house. There are so many responsibilities, and I'm not saying there's not outpatient, because I found out quickly when I did clinical that the task load and the responsibilities are just as much, if not more, outpatient. So like one con, inpatient, if you gotta go tell your patient something or there's something you need done, all you gotta do is type some orders in a computer and they get done. Now, outpatient, I gotta call the patient. I gotta either tell them to come in, then I gotta go back and forth with them if they're gonna come in, or I gotta order something and expect the patient to take the initiative outpatient. So that is something that is a struggle with the outpatient view. So that's why I told y'all at the beginning of the video, I'm not saying one is better than the other. I'm not saying that one is easier than the other, but I'm saying the pace that I have seen in the hospital just might be a little too much for me, and I'm not afraid to say that here. Of course, like people say, well, you already know what to do if this and this happens. Like I said, as a bedside nurse, y'all, I'm running to a rapid response. I'm running to a code. I'm ready to hang this. I'm ready to do that. I'm ready to push this. But as a provider, I think I would be a little stuck in the mud when it comes to these decisions. Now, of course, these are things that, you know, as you practice and as you go, you learn to get more comfortable with. But I just really see myself taking that time to handle these rapid pace situations outpatient versus inpatient. So I will sit here and I will not lie to y'all. I feel like I would be more beneficial, especially with someone who wants to be outpatient. You guys know where the money is at right now, and you know what people drive towards. Everybody in general wants to be in the hospital. So if it's something that I have a passion for, and I also feel like I would be able to also take those bedside skills that I have from inpatient and bring them outpatient to be able to like triage and be able to, you know, brainstorm brainstorm different situations and ways to keep patients out the hospital, I think that's where I would best fit when it comes to this, you know, puzzle of healthcare. All right, guys, so I said I wouldn't keep you long. So 3 of my main reasons, as I spoke to you guys, for choosing FNP over acute care nurse practitioner is 1, the relationship with the patients, 2, my passion to keep patients out of the hospital, and 3, the pace or the responsibilities when it comes to in-person or inpatient versus outpatient. So many of you are going to watch this, and like I said before, this is not to say one is better than the other. It's not to say one is easier than the other. And I know half of you guys already know what the money is between both. If you're using money to make this decision, baby, you need to go back and reevaluate, because that is the wrong way to make this decision. You will be miserable and you will be crazy if you decide this decision based off money. It needs to be on those factors that actually sit with you and ask yourself, why did I choose this field, and what do I think my purpose is? I have plenty of other things I can go on. I can read all my journals. What was my purpose in choosing nursing, etc. And that will all line up with the fact that I need to be taking on the family nurse practitioner specialty. But we don't have a lot of time to do all that. So I just wanted to kind of give you guys 3 aspects of what were my views personally and how I made my decision. Another thing I can definitely just throw out here right on the rim as I'm getting ready to close this video is this schedule, y'all. I mean, I feel like the FNP flexibility is a lot more easier than the inpatient acute care. Now, don't get me wrong, am I looking forward to having to probably work 4 or 5 days a week versus my 312s? No, but as an acute care nurse practitioner, those 312s turn into 7 on 7 offs, on-call schedules, which you also have as, you know, outpatient too. But there's just different scenarios where I really had to sit down with myself and ask, what is my purpose, how will it fit my lifestyle, and what is going to make me happy and what is not going to make me miserable. So in general, this is how I made my decisions. I hope this will help you guys make your decisions or give you a little bit of light into what I'm thinking. Again, nothing I'm saying here is 100%. Nothing here I'm saying is in a textbook, but it is just from the reality of me working and from the reality of me, you know, having my clinical experiences and knowing what my overall purpose is in this nursing field. So if you like what you see here, make sure you comment, make sure you subscribe. If you guys have any input, what are you choosing? What is your reason for it? Again, never to bash either one. I think both are excellent opportunities. And if you are going to be a provider, make sure you choose something that aligns with your purpose. So I'll see you guys in my next video, and thanks so much for watching.